The attending said she was washed up, a military nurse who couldn't handle the real world. He didn't know that she'd spent 18 years keeping soldiers alive in places where death was the default. He was about to find out. Before we begin, tell us where you are watching from. And if you want to support the channel, please subscribe and hit the like button on this video. The emergency department at Washington Memorial Hospital never truly sleeps. The hours between midnight and dawn carry a particular weight. The fluorescent lights hum at a frequency that burrows into the skull. The air smells like antiseptic and burnt coffee. The double doors leading to the ambulance bay open and close with a pneumatic hiss that punctuates every arrival, every departure, every moment between crisis and calm. Dr. Sarah Calloway stood at the nurse's station, her hands moving across a keyboard with the same economy she brought to everything else. Tall, lean, with short salt and pepper hair that required no maintenance. Gray eyes that tracked movement without appearing to look directly at anything. She wore navy scrubs that fit loose enough to move in, and her ID badge listed her as senior staff nurse, a title that made residents assume she'd topped out decades ago. She was 42. She looked older in the eyes, younger in the way she moved. The scar along her left jaw caught the light when she turned her head. Thin, pale, surgical in its precision. No one asked about it anymore. She didn't volunteer. Dr. Marcus Tennant emerged from Trauma Bay 3, stripping off gloves with the casual confidence of someone who'd never doubted his place in the hierarchy. Harvard Medical School, published in The Lancet, chief of trauma surgery at 38. He had the kind of hands that looked good in promotional materials, clean and unblemished. The hands of a man who worked in controlled environments with excellent lighting. He dropped the gloves in the biohazard bin and glanced at Sarah without quite looking at her. Calloway, the appendectomy in Bay 7 is prepped. Straightforward case. Should be good for you. His tone carried the kind of dismissal that didn't require malice, just certainty. Sarah didn't look up from the screen. Her fingers continued typing, finishing the chart note with the same rhythm she'd maintained before he spoke. "I'll take it," she said. Tennant was already walking toward the residence lounge. He didn't wait for confirmation. Why would he? Nurse practitioner Jenna Ortiz stood 2 feet away, restocking a supply cart. 27, sharp-eyed, still young enough to notice things that others had learned to ignore. She watched Tennant disappear through the door, then looked at Sarah. "He always does that," Jenna said quietly. Sarah closed the chart and stood. She picked up the tablet from the counter, her movements smooth and deliberate. No wasted motion. Does what? Gives you the cases no one else wants, the boring ones, or the ones he thinks are too simple to matter. Sarah's expression didn't change. She glanced at the board. Bay 7, appendectomy, routine. Except nothing was ever truly routine if you knew what to look for. "Then I'll make sure it gets done right," she said. She walked toward Bay 7. Her gait was quiet, balanced, the kind of walk that didn't announce itself. Jenna watched her go, noticing the way Sarah's shoulders stayed level, the way her hands hung loose at her sides, ready but not tense. Paramedic Lieutenant Daniel Cross pushed through the ambulance bay doors, rolling a stretcher with his partner. 51 years old, former Marine Corps medic, 23 years on the job. He'd seen enough to recognize patterns. He'd also seen enough to know when someone was carrying more than they showed. He glanced at Sarah as she passed, just a glance. But his eyes caught on her hands for half a second longer than necessary. Those hands, the way the fingers tapered, the faint calluses along the thumb and index finger, the kind you got from specific repetitive motions. Sutures, clamps, instruments held under pressure for hours at a time. He'd seen hands like that before. Not on nurses, on surgeons, field surgeons. He didn't say anything, not yet, but he filed it away. Sarah entered Bay 7 and pulled the curtain closed behind her. The patient was a 23-year-old male, college student, presenting. Scenting with right lower quadrant pain, rebound tenderness, elevated white count. Textbook appendicitis. The kind of case a first-year resident could handle with supervision. She washed her hands at the sink. Hot water, soap. 20 seconds. Muscle memory. She dried them on a paper towel and approached the bedside. The patient looked up at her, pale and sweating. "Are you the doctor?" he asked. "I'm the one who's going to make sure you're okay," Sarah said. Her voice was calm, low. The kind of voice that didn't ask you to trust it but made you want to anyway. She placed her hands on his abdomen. Gentle pressure first, then deeper. Watching his face, watching his breathing, watching the way his body tensed and released. Her fingers moved with precision. McBurney's point, Rovesing's sign, SOAS sign, all positive. But something else caught her attention. A subtle rigidity in the left upper quadrant. Faint, easily missed if you weren't paying attention. She pressed again, watched his pupils dilate slightly. When did the pain start? She asked. Last night, maybe 10 o'clock. Did it move? Yeah, started around my stomach, then moved down here. He pointed to his right side. Any pain anywhere else? He hesitated. My shoulder's been kind of sore, left one. I thought I slept on it wrong. Sarah's expression didn't change, but her mind shifted gears. Left shoulder pain, referred pain, Care's sign, diaphragmatic irritation. She moved her hand to his left upper quadrant again, pressed. His face tightened. She straightened and pulled out her penlight, checked his sclera. Faint jaundice, easy to miss under fluorescent lights. She stepped back and picked up the tablet, pulled up his labs, white count elevated. But also, buried in the differential, a slightly elevated bilirubin. And his hemoglobin, normal on admission 4 hours ago, had dropped 2 points. Internal bleeding, slow, subclinical, but there. Not appendicitis, splenic rupture, delayed presentation, probably from blunt trauma he didn't think was significant. She walked out of the bay and straight to the charge desk. Tennant was reviewing scans with a radiology resident. Sarah didn't wait for him to finish. Bay 7 needs a CT abdomen with contrast, now, and a surgical consult. Tennant turned, eyebrows raised. It's an appy, Calloway. We don't need imaging. We need an OR. He has Care's sign, referred left shoulder pain. Dropping hemoglobin, elevated bilirubin. If you take him to surgery for an appendectomy, he'll bleed out on the table. Tennant stared at her. The radiology resident looked between them. You're a nurse, Tennant said slowly, not a diagnostician. Sarah met his eyes, calm, unwavering. Then prove me wrong. Order the scan. Silence. The hum of monitors, the distant sound of a ventilator. Tennant's jaw tightened. He didn't like being challenged, especially not in front of residents. But he also didn't like being wrong. He turned to the resident. Get the scan. Sarah walked back to Bay 7 without waiting for acknowledgement. If you want to see how Dr. Sarah Calloway saves a senator's life, using a battlefield technique no civilian hospital would dare attempt, make sure you subscribe to Emergency Heroes Stories, because what she does in the next few hours will leave you speechless. The CT scan came back 38 minutes later. By then, Sarah had already prepped the patient for emergency surgery, placed 2 large-bore IVs, and typed and crossed 4 units of blood. She didn't wait for orders. She knew what was coming. Dr. Tennant stood in the radiology reading room, staring at the monitor. The images were undeniable. A grade 3 splenic laceration with active extravasation, blood pooling in the left upper quadrant. The appendix, visible in the lower cuts, looked perfectly normal. He didn't say anything for a long moment, just stared. Dr. Yuki Sato, the attending cardiologist on call, stood beside him. She was 51, Japanese-American, and had spent enough years in medicine to recognize when someone had been underestimated. She called it without imaging, Sato said quietly. Tennant's jaw worked. Lucky guess. Was it? He didn't answer. He walked out of the reading room and back into the emergency department. Sarah was at the nurse's station again, updating the chart. She didn't look up when he approached. You were right, Tennant, Tennant said. His voice was flat, professional, strict of the dismissiveness from earlier. We're taking him up now. Sarah nodded once. He'll need the spleen out, probably a partial. If you can save the lower pole, his immune function will thank you. Tennant opened his mouth, then closed it. He wanted to ask how she knew. He wanted to ask where a senior staff nurse learned to read referred pain patterns and catch subclinical bleeding. But the OR was waiting, and the patient was crashing, and there wasn't time for questions that might have uncomfortable answers. He left. Sarah watched him go, then returned to her screen. Jenna Ortiz approached slowly, holding a tablet but not really looking at it. How did you know? She asked. Sarah didn't look up. Experience. That's not an answer. It's the only one I have. Jenna hesitated, then leaned in slightly. The residents are talking. They're saying you diagnosed something Tennant missed. They're saying you don't work like a nurse. Sarah's fingers paused over the keyboard, just for a second. Then they resumed. I work like someone who pays attention, she said. Jenna didn't push further, but she didn't leave either. She stood there, watching Sarah's hands move across the keys, noticing the way her fingers never hesitated, never second-guessed. The way someone types when they've written 1,000 operative notes and know exactly what needs to be documented. Lieutenant Daniel Cross finished restocking the ambulance and walked back through the ER toward the break room. He passed the nurse's station and saw Sarah still working. He slowed, stopped, pretended to check his radio. He'd been thinking about her hands all night. And now, watching her type, he saw something else. The way she held her shoulders. The way her spine stayed straight, even after hours on her feet. The way her head turned when the double doors opened, scanning, assessing, prioritizing. He'd seen that posture before, in Fallujah, in Kandahar, in field hospitals where the only thing separating life from death was the person who refused to stop moving. He walked closer, casual, non-threatening. You prior service? He asked. Sarah looked up. Her expression was neutral, but something shifted behind her eyes. Recognition, calculation, decision. Long time ago, she said. What branch? Army. MOS. He held his gaze. Medical. Cross nodded slowly. He didn't ask for details. He didn't need to. The way she answered told him everything. Short, controlled. The kind of response someone gives when they don't want to lie, but also don't want to tell the whole truth. Thought so, he said. He tapped the counter once with his knuckles, a gesture of respect, and walked away. Sarah watched him go. Her hands had stopped typing. She looked down at them, at the faint scars along her thumb, the calluses she couldn't hide, the evidence of a life she'd tried to leave behind. She closed the chart and stood. The night wasn't over. It never really was. At 1:15 a.m., the call came in. Ambulance bay, incoming trauma, motor vehicle collision, 2 vehicles, 4 patients. The charge nurse's voice crackled over the intercom. All available staff to the bay. Repeat, all available staff to the bay. Sarah moved, not running, walking fast, efficient. She reached the bay doors just as the first ambulance backed in, lights strobing red and white across the concrete. The paramedics rolled the stretcher out. A woman, mid-30s, unconscious, blood streaked across her face. Her chest rose and fell in shallow, irregular gasps. Unrestrained driver, the paramedics shouted as they rolled past. T-boned at 40 miles per hour. GCS 8. BP 90/60. Tachy at 120. Breath sounds decreased on the left. Sarah fell in step beside the stretcher. She looked at the woman's chest, saw the asymmetry, the way the left side didn't rise as much as the right, the faint bluish tint to her lips, tension pneumothorax, air trapped in the pleural space, collapsing the lung, compressing the heart. They wheeled her into Trauma Bay 2. Tennant was already there, hands going to the woman's neck, feeling for the trachea. It was deviated, shifted to the right. Me need a chest tube, he said. Get me a 36 French and a tray. Sarah was already moving. She grabbed the thoracostomy kit from the supply cabinet and tore it open on the bedside table. Scalpel, clamp, tube, suture. She laid them out in order, left to right, the way a surgeon would want them. Tennant glanced at her, then at the instruments. Perfectly arranged. He didn't comment. He pulled on sterile gloves and prepped the woman's left chest with betadine. I need a 5th intercostal space, he muttered, more to himself than anyone else. 6th is safer, Sarah said quietly. Less vascular. Same result. Tennant's hand paused. He looked at her. You want to do this? It wasn't a real offer. It was a challenge, a test. Sarah met his eyes. I want her to live. Tennant made the incision, pushed the clamp through the intercostal muscles. A hiss of air escaped, high-pitched and unmistakable. He threaded the tube in, attached it to suction. The woman's oxygen saturation began to climb. 92, 94, 97. Her breathing steadied. The blue tint faded. Tennant stepped back, stripping off his gloves. He looked at Sarah, really looked at her this time. Where did you learn to set up a thoracostomy tray like that? He asked. Sarah didn't answer immediately. She was already cleaning up, moving used instruments into the shrubs container, wiping down the table. Repetition, she said finally. That's not an answer. She looked at him, calm, unflinching. It's the only one you're getting tonight. She walked out of the bay. Behind her, Tennant stood in silence. Jenna Ortiz. who'd been recording vitals in the corner, watched Sarah leave. Then she looked at Tennant. "She's not just a nurse, is she?" Jenna said. Tennant didn't answer, but the question hung in the air long after Sarah was gone. The second patient from the collision arrived 4 minutes later. Male, early 40s, restrained passenger, conscious but deteriorating. Paramedics rolled him into Trauma Bay 1, while Tennant was still finishing with the pneumothorax in Bay 2. "We need another attending," the charge nurse said, scanning the board. The other trauma surgeons were in the OR, or handling the overflow from an earlier stabbing. The department was stretched. Sarah stood at the supply cabinet, restocking what she'd used. She didn't turn around, but she was listening, calculating. "Calloway," the charge nurse called, "can you stabilize him until someone's free?" Sarah closed the cabinet and walked toward Bay 1. "What do we have?" The paramedic rattled off vitals as they transferred the patient to the hospital bed. Chest pain, severe, started right after impact. BP 100/70, heart rate 105, respirations 22, no external injuries, complaining of pain radiating to his back. Sarah moved to the bedside. The man was pale, sweating, his hand pressed against his sternum. His eyes were wide, the kind of fear that came from knowing something was very wrong inside your own body. "So, I need you to take slow breaths for me," Sarah said. Her voice was steady, low, the kind of voice that made people believe things might be okay. "Where exactly is the pain?" "Here." He pressed harder against his chest. "And here." He moved his hand around to his shoulder blade. "It feels like something's tearing." Sarah's mind shifted. Chest pain radiating to the back. Sudden onset. Post-trauma. The differential narrowed immediately. Aortic dissection. A tear in the inner layer of the aorta. Blood forcing its way between the layers of the vessel wall. If it ruptured completely, he'd be dead in seconds. She looked at the monitor. Blood pressure in the right arm, 100/70. She reached for his left wrist, felt the pulse, weak, thready. "I need a BP on the left arm," she said to Jenna, who'd followed her in. Jenna wrapped the cuff, pumped, watched the gauge. 80/50, Jenna said. 20-point discrepancy between arms. Pathognomonic for dissection. Sarah turned to the charge nurse. "Call the cath lab. Tell them we need an emergent CT angiogram, possible ascending aortic dissection, and page cardiothoracic surgery, now." The charge nurse hesitated. "Tennant hasn't signed off. And get him in here, but make the calls first." The authority in Sarah's voice left no room for argument. The charge nurse picked up the phone. Tennant walked in 30 seconds later, still pulling off his gloves from Bay 2. "What's going on?" 20-point BP differential between arms, tearing chest. "Stop pain radiating posterior, post-trauma. He's dissecting." Tennant moved to the bedside, checked the monitor, felt the patient's pulses. His expression tightened. "You called it before imaging?" "We don't have time for imaging if he ruptures," Sarah said. "But yes, I called it." Tennant looked at her. There was something different in his eyes now. Not dismissal, not even skepticism. Caution and curiosity. "If you're wrong, I'm not." He held her gaze for a long moment. Then he turned to the team. "Get him to CT, fast, and someone call Dr. Maida in CT surgery. Tell him we might have a AAA dissection." They moved, fast, coordinated. The patient was on the stretcher and rolling toward the elevator within 90 seconds. Tennant stayed behind, so did Sarah. The trauma bay felt suddenly quiet, the chaos having moved elsewhere. "You've done this before," Tennant said. It wasn't a question. Sarah began cleaning the bedside table, wiping down surfaces, restocking supplies, not looking at him. "I've seen it before," she said. "Where?" She paused, just for a second, her hands stilled on the disinfectant bottle. "Does it matter?" "It does if you're making clinical decisions above your pay grade." Sarah turned to face him. Her expression was calm, but there was something behind it now, something harder. "I made the right call, twice tonight. If that's a problem, write me up, but do it after we know whether he survives." Tennant didn't respond immediately. He was weighing something. She could see it in the way his jaw worked, the way his eyes tracked her movements. "Who are you?" he asked quietly. Before Sarah could answer, her pager went off. She glanced down. Trauma alert. Mass casualty incident. Multiple victims inbound. The intercom crackled to life. "All available personnel to the ER. Repeat. Mass casualty alert. Explosion near Capitol Hill. Estimated 15 to 20 victims. First wave arriving in 3 minutes. The overhead lights seemed to brighten. The air changed. That particular frequency of controlled chaos that every emergency department knew too well. Sarah clipped the pager back to her belt and looked at Tennant. "You'll have your answer soon enough," she said. She walked out. Tennant watched her go, then followed. The ambulance bay became a staging area. Stretchers lined up, nurses and residents moving into position. The charge nurse directing traffic like an air traffic controller. Dr. Sato appeared from the cardiology wing, pulling on a trauma gown. Sarah moved to the triage station. She didn't ask for permission. She simply took position, her hands already reaching for the color-coded tags. Red, yellow, green, black. The first ambulance arrived. Then the second. Then 3 more in quick succession. The doors opened. The wounded came through. A man with his leg shredded below the knee. A woman with burns across her chest and arms. A teenager with a piece of metal embedded in his shoulder. An elderly man unconscious, blood pouring from a head wound. Sarah moved between them. Her eyes scanned, assessed, decided. Red tag, Bay 4, stat. Yellow tag, Bay 6, monitor for compartment syndrome. Green tag, waiting area, irrigate and dress. She moved like water, fluid, uninterrupted. Her hands touched necks, wrists, abdomens, checking pulses, checking perfusion, checking for the invisible injuries that killed when people stopped paying attention. Tennant worked 3 stretchers away. He kept glancing at her, watching the way she moved, the way she made decisions in seconds that should have taken minutes, the way everyone around her simply followed her lead without question. A paramedic rolled in another patient, a young woman, early 20s, unconscious, face covered in soot, chest barely moving. Found her under debris. The paramedic said, "Respirations shallow. GCS 6, possible smoke inhalation." Sarah moved to her immediately, looked at the woman's chest, listened, faint wheezing, but something else, a subtle asymmetry in the rise and fall. She placed her hands on the woman's chest, felt the crepitus, subcutaneous emphysema, air trapped under the skin. "She's got a pneumothorax," Sarah said, "and possible tracheobronchial injury. We need to tube her now before she loses her airway completely." A resident appeared with an intubation kit. Sarah took the laryngoscope without asking. She positioned the woman's head, opened her mouth, visualized the cords. Tennant was suddenly beside her. "Calloway, let me." "Hold cricoid pressure," Sarah said. Not a request, a command. Tennant hesitated, then his hands moved to the woman's throat, applying pressure, stabilizing. Sarah slid the tube in, smooth, controlled, 1 attempt. She inflated the cuff, connected the bag, squeezed. The woman's chest rose, both sides equal. Sarah listened with her stethoscope. Breath sounds present bilaterally. She secured the tube and stepped back. "Get her to CT, then OR. She's going to need a bronchoscopy and possible repair." The resident stared at her. "How did you move?" Sarah said, not harsh, just final. They moved. Tennant stood there, hands still raised from where he'd been holding pressure. He looked at Sarah. She was already walking to the next patient. "You just intubated a difficult airway in under 30 seconds, he said. Sarah didn't stop walking. She needed an airway. I gave her one. Nurses don't intubate. Sarah paused, turned, looked at him with those calm gray eyes. Tonight, this one did. She disappeared into the next trauma bay. Behind her, Tennant stood in the fluorescent light, surrounded by chaos, finally understanding that everything he'd assumed about Sarah Calloway had been wrong from the beginning. The emergency department had become a war zone without the war. 15 patients from the Capitol Hill explosion, each one a puzzle of torn flesh and fractured bone. The fluorescent light seemed harsher now, illuminating everything with a clarity that made the blood look brighter, the faces paler. Sarah moved through it all with the same controlled rhythm, bay to bay, patient to patient. Her hands never shook, her voice never rose. She was the still point in a turning world. By 2:30 a.m., the initial wave had been stabilized. The red tags were in the OR. The yellow tags were being monitored. The green tags were in the waiting area, being treated by residents and nurses who finally had a moment to breathe. Sarah stood at the sink in the staff hallway, washing her hands. The water ran pink, then clear. She scrubbed methodically, under the nails, between the fingers, 20 seconds. Muscle memory from a life she'd tried to forget. Dr. Sato appeared beside her, starting her own hand-washing ritual. "You work like a trauma surgeon," Sato said quietly. Sarah didn't look up. I work like someone who's seen trauma. There's a difference between seeing it and managing it. You managed it. Sarah dried her hands, tossed the paper towel in the bin. She met Sato's eyes briefly, then looked away. People needed help. I helped them. That's not an answer either. Sarah almost smiled, almost. You sound like Tennant. Tennant's been asking questions about you, to administration, to HR. He wants to know where you trained. Sarah's expression didn't change, but something tightened around her eyes. What did they tell him? That you came from County General 3 years ago. Before that, a rural hospital in Virginia. Before that, Sato paused. The records get vague. Sarah turned to leave. Sato's voice stopped her. I was in the Navy, 20 years. I know what a military surgeon looks like when I see one. Sarah looked back. Their eyes met. A long moment passed. Recognition between people who'd lived in worlds most civilians couldn't imagine. I'm not hiding, Sarah said quietly. I'm just not advertising. Why not? Because some things you can't go back to, even when they made you who you are. She walked away before Sato could respond. Sarah returned to the nurse's station to find Tennant waiting. He stood with his arms crossed, still wearing his trauma gown, spattered with blood that wasn't his. His expression was unreadable. My office, now, he said. It wasn't a request. Sarah followed him down the hallway to the small administrative office he used between surgeries. The door closed behind them. The sounds of the ER muffled but still present. A constant reminder that the chaos never truly stopped. Tennant moved behind his desk but didn't sit. Neither did Sarah. They faced each other across 4 feet of space that felt like a chasm. I've been watching you all night, Tennant said. You've made 3 diagnostic catches that would challenge most attendings. You intubated a difficult airway on the first attempt. You set up surgical trays like you've done it 1,000 times. You move through trauma with a confidence that doesn't come from nursing school. Sarah said nothing. Her hands stayed at her sides, loose, ready. So I'm going to ask you again, Tennant continued. Who are you? You've read my file. I read what you gave HR. I want to know what you didn't give them. Sarah held his gaze. She was calculating, weighing options, deciding how much truth was necessary and how much would cost her the anonymity she'd worked 3 years to build. Before she could answer, both their pagers went off simultaneously, the sound sharp and insistent in the small office. They looked down. The message was identical on both screens. Trauma alert, code blue, VIP patient inbound, Senator Richard Harmon, cardiac arrest, ETA 2 minutes. Tennant's eyes widened. Harmon? The Senate Majority Leader? Sarah was already moving toward the door. Doesn't matter who he is, he's coding. They ran, back through the hallway, into the ER. The trauma team was already assembling. Nurses, residents, respiratory therapy. The crash cart positioned and ready. The ambulance bay doors burst open. Secret Service agents poured in first, scanning, securing. Then the paramedics with the stretcher. Senator Richard Harmon, 68 years old. Gray hair. Distinguished features now slack and pale. CPR in progress. An agent in a suit doing chest compressions with textbook form but visible desperation. He collapsed during a security briefing, the lead agent said, still doing compressions as they rolled. No pulse. We've been doing CPR for 8 minutes. 2 rounds of epi. No response. They transferred him to the trauma bay bed. The team swarmed. Sarah moved into position on the left side. Tennant took the head. Resume compressions, Tennant ordered. A resident took over. Get me an airway kit. Someone pull up his medical history. Does he have a cardiac history? Unknown, the agent said. His medical records are classified. Tennant looked up sharply. Classified? National security. He's been targeted before. Assassination attempt in 2019. Any medical information could be used against him. Sarah's hands stilled on the defibrillator pads she'd been placing. Her mind raced backward. 2019. Assassination attempt. She looked at Harmon's exposed chest, saw the faint scars, surgical scars, old but distinctive, midline sternotomy, thoracotomy, the pattern of a cardiac repair. He's had previous cardiac surgery, Sarah said. Looks like a valve replacement or coronary bypass, maybe both. The resident doing compressions glanced at her. How can you tell? The scars, she pointed. Sternotomy here, Thoracotomy access here. This wasn't routine. This was emergent repair. Tennant moved closer, looking at what she'd seen. His expression shifted. If he's had previous cardiac surgery, we need to know what was done. Scar tissue changes everything. The monitor showed a systole, flatline. No electrical activity, no hope by conventional measures. Push another epi, Tennant said. Continue compressions. Let's shock him again. They shocked. The body convulsed. Settled. The monitor remained flat. Again. Shock. Nothing. Again. Shock. Still nothing. Tennant looked at the clock. 12 minutes down. No response to ACLS protocol. One of the residents spoke quietly. Dr. Tennant, maybe we should— No, Sarah said. Her voice cut through the room. Firm. Absolute. We're not calling it. Everyone looked at her. Tennant's jaw tightened. Calloway, he's been down 12 minutes with no rhythm. We followed protocol. There's nothing. Protocol isn't enough. Sarah moved closer to the bedside. Her eyes locked on Harmon's chest, on those scars, on the story they told. She looked up at Tennant. If he had previous cardiac surgery after an assassination attempt, there's a possibility he has retained foreign material, shrapnel, fragments, something that could cause a pericardial effusion or tamponade. That's why he's not responding. The heart can't fill, can't pump. You can shock him 100 times and it won't matter if the problem is mechanical, not electrical. Tennant stared at her. You're talking about a pericardial window, here. In the ER. I'm talking about saving his life. That's a surgical procedure. We'd need to take him to the— Or, he'll be dead before you get him there. You know it? I know it. The room went silent. Only the sound of continued compressions. The mechanical rhythm of someone refusing to let death win. Tennant looked at Sarah. Really looked at her. At the calm in her eyes. The certainty. The absolute lack of fear. You've done this before, he said quietly. Sarah didn't blink. Yes. Where? She held his gaze. The truth was right there, visible in the set of her shoulders. The steadiness of her hands, the weight of decisions made in places where hesitation meant death. Kandahar, she said. Helmand Province, forward surgical teams. 18 years, 3 tours. I've done this exact procedure 17 times in field hospitals with half the equipment we have here, and twice the chaos. The room seemed to stop breathing. Tennant's eyes widened. You're a surgeon? I was a surgeon. Now I'm trying to save a man's life. Are you going to let me? Or are we going to watch him die while we debate credentials? Tennant didn't move. His mind was processing too many things at once. A nurse who was actually a military trauma surgeon. A senator dying on the table. A procedure that violated every protocol, but might be the only thing that could work. He looked at the monitor. Still flatline. Looked at the clock. 13 minutes down. If you're wrong, he started. Then he dies. Same outcome as if we do nothing. Sarah's voice was steady. But if I'm right, he lives. Your call, doctor. The weight of the decision pressed down on the room. Every person present felt it. The residents, the nurses, Jenna, standing in the corner with wide eyes. The Secret Service agents, hands hovering near weapons they couldn't use. Tennant's jaw worked. He was the chief of trauma surgery, Harvard-educated, published researcher. He'd built his career on evidence-based medicine, on peer-reviewed protocols, on the certainty that came from doing things the right way. But the right way wasn't working. He looked at Sarah, at the calm certainty in her gray eyes, at hands that had stopped shaking years ago in places most people only saw on the news. Do it, he said. Sarah moved immediately. I need a thoracotomy tray, scalpel, rib spreaders, clamps, betadine, suction, and keep compressions going until I tell you to stop. The team exploded into motion. Jenna grabbed the thoracotomy kit from the supply cabinet. Another nurse prepped Harmon's chest with betadine, the brown antiseptic staining his pale skin. Sarah pulled on sterile gloves with movements so fast and practiced, they seemed like muscle memory playing at double speed. She took the scalpel, held it over Harmon's chest. The room held its breath. Stop compressions, she said. The resident's hands lifted. The rhythm that had sustained the senator for 13 minutes ceased. Silence except for the flatline tone of the monitor. Sarah made the incision. A single smooth stroke below the left nipple, following the 5th intercostal space. Blood welled up immediately. She didn't hesitate. Deepened the cut through skin, subcutaneous tissue, muscle. The layers parted under her blade like she'd done this 10,000 times. Because she had. Rib spreader, she said. Her voice was calm, almost conversational. Like she was teaching a resident in a controlled OR instead of performing battlefield surgery in an ER trauma bay. Tennant handed her the spreader himself. She placed it, cranked. The ribs separated with a sound that made two of the residents look away. The pericardium came into view, the thin sac surrounding the heart. It was distended, bulging, filled with fluid that shouldn't be there. Tamponade, Sarah said, just like I thought. She took a fresh scalpel and made a small incision in the pericardium. Dark blood gushed out, not the bright red of arterial bleeding. The darker red of venous blood that had been trapped, compressed, preventing the heart from filling. The moment the pressure released, everything changed. The heart, previously still and lifeless, twitched. A small movement, then another. Trying to beat, but not quite succeeding. There, Sarah said. She reached in with her hand. Her fingers found the heart. She began to massage. Gentle compressions, rhythmic, squeezing blood through chambers that had forgotten how to move on their own. The monitor changed. A blip. Then another. V-fib. Chaotic. Tick but alive. Charged to 200, Sarah said. Her hand still inside the chest, still massaging. Internal paddles. A nurse brought them. Small paddles designed for direct cardiac contact. Sarah took them in her free hand, positioned them on either side of the heart. Clear. Everyone stepped back. Sarah delivered the shock. The heart convulsed in her hand. She felt it, the muscle contracting, fighting. The monitor showed a rhythm, irregular, weak, but a rhythm. Again, 300. Clear. Shock. The heart spasmed. Then, impossibly, it began to beat on its own. Slow at first, then stronger, finding its rhythm like an engine remembering how to run. The monitor showed sinus rhythm, 70 beats per minute. Blood pressure rising, 60/40, 70/50, 80/60. Sarah kept her hand on the heart, feeling it beat, feeling life return to tissue that had been dead minutes ago. She looked inside the pericardial space. Saw what she'd suspected, a small metal fragment, no bigger than a grain of rice, embedded in the myocardium. Probably a remnant from the 2019 assassination attempt. It had slowly eroded through tissue over 5 years until tonight, when it finally caused enough irritation to create bleeding into the pericardial sac. She extracted it with forceps, held it up. The overhead light caught the metal. Shrapnel, she said. Looks like a fragmentation pattern from an IED or similar device. It's been slowly migrating. Tonight, it caused enough inflammation to bleed into the pericardium. Tennant stared at the tiny fragment, then at Sarah, then at the senator, whose color was returning, whose chest was rising and falling with ventilator breaths, whose monitor showed a heart rhythm that was growing stronger by the second. You just brought him back from the dead, Tennant said quietly. Sarah shook her head. I just removed the thing that was killing him. His heart did the rest. She began to close, irrigated the pericardial space with saline, placed a drain, closed the pericardium with running suture. Her hands moved with practiced efficiency. No wasted motion, no hesitation. This was what she'd been trained to do, what she'd done in field hospitals in Kandahar, while mortars fell outside and generators struggled to keep the lights on. 15 minutes later. The chest was closed. The drain was in place. Harmon's vitals were stable. Heart rate 80. Blood pressure 100/70. Oxygen saturation 98%. Sarah stepped back, stripped off her gloves. Her scrubs were covered in blood. Her hands were steady. The room was silent, everyone staring at her, at what she'd just done, at the impossibility made real. One of the Secret Service agents spoke first. You saved his life. Sarah didn't respond. She was already moving to the sink, washing her hands. The water ran red again. Tennant followed her, stood beside her while she scrubbed. His voice was quiet when he spoke. 18 years, 3 tours, forward surgical teams. He paused. Why are you working as a nurse? Sarah kept washing. Because being a surgeon in the army and being a surgeon in a civilian hospital are 2 different things. One of them I couldn't do anymore. Why not? She turned off the water, dried her hands, looked at him with those gray eyes that had seen too much. Because the last field hospital I worked in took a direct hit. Suicide bomber. 6 of my staff died. 3 patients died. I was the only surgeon who made it out. Her voice was flat, factual, empty of emotion because emotion would break her. I couldn't walk into another OR after that. Couldn't make decisions about who lived and who died when my decisions got people killed. Tennant's expression softened. That wasn't your fault. Tell that to their families. Silence, the sound of the ER continuing around them, monitors beeping, voices calling, life going on because it always did. You just saved a senator's life using a technique no civilian hospital would attempt, Tennant said. You made the right call when everyone else would have given up. That's not someone who should be hiding behind a nurse's badge. Sarah looked at him. I'm not hiding. I'm surviving. Before Tennant could respond, Dr. Sato appeared. We need to get Harmon to the ICU, and someone needs to brief the Secret Service and call the vice president. This is going to be national news within the hour. Tennant nodded, looked at Sarah. We're not done talking about this. Sarah walked past him. Yes, we are. But they both knew it was a lie. Everything had changed the moment she'd opened that chest. There was no going back now. The door she'd tried to close 3 years ago had been kicked open, and standing on the other side was the person she'd been before the bombing. The surgeon. The soldier. The woman who refused to let people die when she could save them. She'd spent 3 years running from that person. Tonight, she'd become her again. And this time, there was nowhere left to hide. Senator Harmon was stable in the ICU by 3:45 a.m. Sarah stood outside the glass doors, watching the monitors, watching the steady rise and fall of his chest, watching the proof that sometimes the impossible was just another word for difficult. She'd changed scrubs. The blood-stained ones were in a biohazard bag somewhere, but she could still feel the weight of them, could still feel the warmth of Harmon's heart beating in her hand. That moment when dead tissue remembered how to live. Footsteps behind her. She didn't turn. She knew who it was. The vice president wants to meet you, Tennant said. So does the director of the Secret Service, and about 15 different news agencies who somehow already know a nurse performed battlefield surgery in a civilian ER. Sarah didn't respond, just kept watching the monitors. You can't hide from this, Tennant continued. You saved the Senate Majority Leader's life. You did something that will be taught in trauma courses for the next decade. People are going to want answers. I don't have answers, Sarah said quietly. I just have scars and a skill set I've been trying to forget. Tennant moved beside her, looked through the glass at Harmon. Why did you leave the military? Sarah's jaw tightened. She'd avoided this question for 3 years, deflected it, buried it. But tonight had excavated everything she'd tried to keep underground. Kandahar, July 2019. We were running a forward surgical team attached to a combat outpost. Small facility. Makeshift OR. We were handling routine casualties, gunshot wounds, IED injuries. Nothing we hadn't seen 100 times before. Her voice was steady but distant, like she was reading from a report instead of remembering the worst day of her life. A local boy came in, maybe 12 years old, stepped on a mine. His leg was gone below the knee. We stabilized him, started surgery. His mother was waiting outside. She paused, breathed, continued. While we were operating, a suicide bomber walked through the perimeter, dressed as a civilian. Got past security because we were treating locals and the guards assumed he was family. Tennant said nothing, just listened. He detonated in the waiting area, 20 feet from the OR. The blast came through the walls, killed 3 patients immediately, killed 2 nurses, killed my anesthesiologist. The roof collapsed. I was trapped under debris, with the boy still on the table, her hands clenched at her sides. I could hear people screaming, could hear my staff dying, could hear the mother calling for her son. And I couldn't move, couldn't help anyone. Just had to wait while the kid bled out in front of me because I couldn't reach the clamps to stop the bleeding. She stopped, swallowed. By the time they pulled me out, 6 people were dead. The boy, his mother, who'd been in the blast, 4 of my staff. And it was my decision that killed them. What decision? Tennant asked quietly. I authorized treating local civilians in the facility. I pushed for expanded access. I argued with Canand that we had a moral obligation to help everyone, not just coalition forces. Her voice was raw now. I was right, morally, ethically, but tactically, I created the vulnerability that got them killed. The bomber exploited exactly what I'd fought to create. That's not on you, Tennant said. That's on the person who chose to murder civilians. Sarah finally looked at him. Her eyes were hard. Tell that to the families. Tell that to the kids who grew up without parents, because I made a call that seemed right at the time but got people killed. So you walked away. I couldn't walk into another OR, couldn't make another decision about life and death when my judgment had already failed so catastrophically. Ickily, she looked back through the glass. I took early retirement, came back to the States, got my nursing certification, took positions where I could help people without having to be the one making the final call, where I could assist instead of lead, where if something went wrong, it wouldn't be because of me. Tennant was quiet for a long moment. Then he spoke. You've been punishing yourself for 3 years for doing the right thing in an impossible situation. The right thing got 6 people killed. The right thing saved thousands before that. And tonight, it saved a senator who would be dead if you'd kept hiding. Sarah shook her head. Tonight was different. Tonight, I didn't have a choice. You always have a choice. You chose to act. You chose to use skills you've been burying because you were afraid of making another mistake. And because you made that choice, a man is alive. Before Sarah could respond, Dr. Sato appeared with a tablet. Her expression was complicated. Respect mixed with something else. Concern, maybe. Or caution. You need to see this, Sato said. She held up the tablet. It showed a news feed, CNN. Breaking news banner, Senator Harman in critical condition after cardiac arrest. Sources say military surgeon performed emergency battlefield procedure. Below that, a second feed, Fox News. Former Army surgeon saves Senate leader using technique banned in most civilian hospitals. And a third, MSNBC. Who is Dr. Sarah Calloway, the Kandahar surgeon who disappeared 3 years ago? Sarah stared at the screen, her face drained of color. They have your name, Sato said quietly. They have your service record. Someone leaked it. Probably Secret Service. Within the hour, every news agency in the country is going to be trying to find you. Sarah's hands trembled, just slightly. The first time I'll note. I can't do this, she said. I can't be that person again. You already are, Tennant said. You were the moment you opened Harman's chest. The question now is what you do next. Sarah looked at him, then at Sato, then back through the glass at the man whose life she'd saved with techniques she'd learned in a war zone half a world away. I came here to disappear, she said quietly, to be anonymous, to help without being responsible. That's not who you are, Tennant said. I've watched you all night. You don't assist, you lead. You don't follow protocol when protocol is wrong. You make the call that needs to be made, even when everyone else is too afraid to make it. That's not a nurse. That's not even just a surgeon. That's a commander. I don't want to command anything. Maybe not, but people need you to. The ICU doors opened. A Secret Service agent stepped out. Tall, dark suit, earpiece, professional face with a hint of gratitude underneath. Dr. Calloway, he said. Sarah turned. Yes. The vice president would like to speak with you. And Senator Harman is awake. He's asking for the person who saved his life. Sarah's breath caught. He's awake? Sedated, but conscious. The cardiologist says his heart function is better than expected. They're calling it a miracle. The agent's expression softened. He wants to thank you personally. Sarah looked at Tennant, then at Sato, then back at the agent. She could walk away, right now, refuse the attention, disappear again, find another hospital in another city and bury herself in anonymity until the news cycle moved on. But she could also walk through those doors, face the man she'd saved, face the person she'd been before Kandahar broke her, face the possibility that maybe, just maybe, she could be that person again without it destroying her. She thought about the boy on the table, about his mother's voice calling for him, about the weight of the roof collapsing and the feeling of being trapped while people died around her. Then she thought about Harman's heart beating in her hand, about the moment it started again, about the lives she'd saved tonight, not despite her training, but because of it. She'd spent 3 years running from Kandahar, but Kandahar had made her who she was. The trauma, the loss, the impossible decisions. They'd forged her into someone who could stand in chaos and find the pattern, who could see what others missed, who could make the call when everyone else froze. Maybe that person wasn't something to run from. Maybe that person was something to reclaim. Sarah straightened her shoulders. The trembling in her hands stopped. Her voice was steady when she spoke. "Take me to him," she said. She walked through the ICU doors. Tennant and Sato watched her go. Through the glass, they could see her approach Harmon's bedside, see the senator's eyes open, see his hand reach out weakly, see Sarah take it. They couldn't hear what was said, but they could see Harmon mouth 2 words. "Thank you." And they could see Sarah nod, just once, accepting something she'd refused for 3 years. The gratitude, the recognition, the truth that she was still a surgeon, still a commander, still the person who ran toward the crisis instead of away from it. Outside, the sun was beginning to rise. The night shift was ending, and Sarah Calloway, who'd spent 3 years hiding from her past, was finally stepping back into it. Not because she wanted to, but because some people didn't get to choose who they were. They just got to choose what they did with it. And Sarah had always chosen to save lives, even when it cost her everything. The hospital conference room at 6 p.m. felt surreal, too clean, too quiet, too far removed from the blood and chaos of the night before. Sarah sat at the long table, still in scrubs, her hair pulled back, exhaustion written in the lines around her eyes, but her posture straight. Military straight. Across from her sat hospital administration, Dr. Ellen Voss, Chief Medical Officer, Richard Crane, Hospital CEO, legal counsel whose name Sarah hadn't caught, and Dr. Marcus Tennant, who'd positioned himself beside her rather than across from her. A subtle shift that hadn't gone unnoticed. Dr. Voss spoke first. She was 62, gray hair in a tight bun, reading glasses perched on her nose. She looked at Sarah with an expression somewhere between admiration and deep concern. "Dr. Calloway," she began, using the title deliberately. "In the past 8 hours, you've made 3 critical diagnoses that attending physicians missed, performed an intubation, and conducted a resuscitative thoracotomy in an emergency department. You've also been working under a nursing license, while possessing surgical credentials you never disclosed." Sarah's jaw tightened. "I disclosed everything required by law. My nursing certification is legitimate. I never claimed to be anything I'm not." "You also never claimed to be what you are," Crane said. His tone wasn't accusatory, just factual. "Former U.S. Army trauma surgeon. 18 years of service, multiple commendations, published research in battlefield medicine. You could have been hired as an attending surgeon at virtually any hospital in the country. Instead, you've been working night shifts as a nurse. Why?" Sarah met his eyes. "Because I wanted to help people without the weight of command. I wanted to assist, not lead. I wanted—" She paused, choosing words carefully. "I wanted to practice medicine without the responsibility of life and death decisions being solely on my shoulders. And yet last night, you made exactly those decisions," Voss said. "Multiple times, and each time, you were right. Last night was different." "How?" "Because people were dying, and I was the only one who could see why." Silence filled the room. The truth of that statement hung in the air like smoke. Tennant leaned forward. "I was wrong about you. I dismissed your observations. I questioned your judgment. I treated you like someone who didn't belong in the room, when you were the most qualified person there." His voice was steady, genuine. "I'm formally apologizing. In front of administration, on record." Sarah looked at him. Surprise flickered across her face. "You don't need to." "I do, because my ego almost cost us a senator's life, and probably cost us other lives over the past 3 years, because I wasn't listening to someone who saw things I couldn't." Voss removed her glasses. "Dr. Calloway, the question we're facing now is what happens next. Senator Harmon is alive because of you. That's going to be national news. It already is. We have reporters camped outside. The Vice President's office has called 4 times. The Secretary of Defense wants a briefing. You can't go back to being anonymous. That door is closed." "I understand," Sarah said quietly. "So we need to discuss your future here," Voss continued. "You can't continue as a senior staff nurse. It's not appropriate given your qualifications. It's also not fair to you or to the patients who need your level of expertise." Sarah's stomach tightened. This was the moment she'd been dreading. The moment they told her she didn't fit. that her attempt to rebuild a smaller, quieter life had failed, that she'd have to leave and start over somewhere else. "We want to offer you a position," Crane said. Sarah blinked. "What?" "Attending trauma surgeon, with a specialty focus on combat casualty care adaptation for civilian environments." Crane slid a folder across the table. "We want you to develop a program, training protocols, teaching residents and attendings the techniques you used last night. Triage systems, damage control surgery, hypotensive resuscitation, all the military medicine that could save civilian lives but hasn't been properly integrated." Sarah stared at the folder. "Didn't touch it." "We'd also like you to lead a new initiative," Voss added. "A veteran integration program, helping former military medical personnel transition into civilian practice. Too many highly skilled people leave service and end up underemployed or struggling because civilian systems don't recognize their training. You could change that." Sarah's throat tightened. "Why would you trust me with that?" "Because you've lived it," Tennant said. "You know what it's like to come back and feel like you don't fit, to have skills that don't translate on paper, to carry trauma that nobody talks about. You could help people who are where you were 3 years ago." Sarah looked down at her hands, at the faint scars, at the calluses, at the evidence of a life spent holding people together while the world tried to tear them apart. "I left the military because I got people killed," she said quietly. "Because my judgment failed. Because I made a decision that felt right and it cost 6 lives." Voss leaned forward. "We've read the after-action report, the classified one, the one that was declassified last year as part of a DoD transparency initiative." Sarah's head snapped up. "What?" "The Kandahar bombing, July 2019. The investigation concluded that the suicide bomber bypassed security using forged credentials that identified him as a coalition interpreter. He was on an approved access list. Multiple security checkpoints cleared him. Your decision to treat local civilians wasn't the vulnerability. The vulnerability was a systemic failure in credential verification that had nothing to do with you." Sarah's breath stopped. "That's not— I was told— You were told what command thought you needed to hear to process the trauma," Voss said gently. "But the official finding was clear. The bombing was a sophisticated attack that exploited security protocols, not medical policies. You were never at fault. You were just the survivor who carried the guilt." The room swam. Sarah gripped the edge of the table. 3 years. 3 years of believing she'd killed her team. 3 years of hiding because she thought her judgment was compromised. 3 years of penance for a sin she'd never actually committed. "Why didn't anyone tell me?" Her voice cracked. "I don't know," Voss said. "Maybe they thought you knew. Maybe communication failed in the chaos of your medical discharge. Maybe someone made a judgment call that was wrong. But you've carried blame that was never yours to carry." Tears stung Sarah's eyes. She blinked them back, forced herself to breathe. In, out, the way she'd learned in therapy. The way she'd taught herself to get through the nights when the memories came back. Tennant's voice was soft when he spoke. "You spent 3 years punishing yourself for being a good doctor in an impossible situation. Maybe it's time to stop punishing and start teaching. Start leading. Start being who you actually are instead of who trauma told you to be." Sarah looked at the folder again, reached out, touched it. The paper was real, solid, an offer to step back into the light after 3 years in the shadows. "I don't know if I can do this," she said. "You already did," Crane said. "Last night, when you opened Senator Harmon's chest and refused to let him die. When you saw what everyone else missed. When you made the call that saved his life. That's who you are. The question is whether you're ready to be that person in daylight instead." Out of just on night shifts when no one's watching, Sarah opened the folder, read the offer. Attending trauma surgeon, program director, salary that reflected her actual qualifications, and at the bottom, a clause that made her breath catch. Full autonomy to develop curriculum and training protocols based on military medical experience, with authority to override standard civilian protocols when clinical judgment supports alternative approaches. She looked up at Voss. "You're giving me permission to break protocol?" "We're giving you permission to use your judgment. The judgment that saved 4 lives last night. The judgment that comes from 18 years of making impossible decisions in impossible places. We trust that judgment. The question is whether you trust it." Sarah closed the folder, looked at each person in the room, saw respect, saw belief, saw something she hadn't seen directed at herself in 3 years. Hope. She thought about the boy in Kandahar, about his mother's voice, about the weight of grief she'd carried believing she'd caused it. And now, knowing she hadn't, knowing that the enemy had killed them, not her decisions, knowing that her instinct to help everyone, to treat civilians alongside soldiers, hadn't been wrong, just human. She thought about Senator Harmon's heart beating in her hand, about the residents watching her work, about Jenna's wide-eyed admiration, about Lieutenant Cross recognizing something in her that she'd tried to hide. She'd spent 3 years running from who she was. Maybe it was time to run toward it instead. I have conditions, Sarah said. Crane nodded. Name them. I want final say on hiring for the program. I want to recruit veterans personally. I want to make sure they're supported, not just employed. Mental health resources, transition counseling, peer support, the whole infrastructure. Agreed. And I want to maintain some clinical hours in the ER. I don't want to be just an administrator. I want to be in the field. Also agreed. Sarah took a breath, let it out slowly, nodded once. Then yes, I accept. 6 months later, the Trauma Simulation Center at Washington Memorial looked nothing like it had before. The walls were lined with equipment, not just the standard civilian gear, but military-grade supplies, tourniquets, hemostatic dressings, portable ultrasound units. The kind of tools that saved lives when hospitals were tense and the nearest OR was a helicopter ride away. Dr. Sarah Calloway stood at the head of the room, wearing navy scrubs and a white coat that finally matched her qualifications. Her hair was still short, still practical. The scar on her jaw still visible, but something had changed in her eyes. The weight was still there, the knowledge of what she'd seen and done, but the guilt had lifted. In its place was purpose. 20 residents and 5 attending physicians sat in front of her, a mix of civilian-trained doctors and newly recruited veterans, former Navy corpsmen, former Army medics, former Air Force pararescue, people who'd spent years saving lives in impossible conditions and then struggled to find their place in a system that didn't recognize their expertise. Sarah had found them, recruited them personally, helped them navigate credentialing, fought with licensing boards, built a program that valued combat experience as much as medical school pedigree. Hypotensive resuscitation, Sarah said, advancing the slide. In civilian medicine, we're taught to restore blood pressure immediately. In battlefield medicine, we learned that sometimes keeping pressure low prevents rebleeding until you can get to definitive surgical control. Today, we're going to talk about when to apply that principle in civilian trauma. She clicked to the next slide. A case study, a motorcycle accident, blunt abdominal trauma, the kind of case that came through the ER every week. Standard protocol says fluid resuscitation to maintain systolic above 90. But what if that approach causes more harm than good? She looked at the residents. Who can tell me why? A hand went up. Young woman, late 20s, former Army medic named Rodriguez. She'd served 2 tours in Iraq before going to medical school on the GI Bill. Because if there's ongoing bleeding, raising blood pressure can disrupt clot formation and increase hemorrhage, Rodriguez said. In combat, we'd keep them hypotensive until we could get them to a field hospital for damage control surgery. Exactly, Sarah said. And that principle applies here. Permissive hypotension until you can achieve surgical hemostasis. It's not in the standard ATLS protocol, but it saves lives. You just have to know when to use it. The door at the back of the room opened. Dr. Tennant walked in, followed by Dr. Sato and Jenna Ortiz, who'd been promoted to the training program's clinical coordinator. They took seats in the back row. Sarah nodded to them and continued. For the next hour, she taught. Not just from textbooks, but from experience. From the 18 years she'd spent in places where medicine was practiced with half the resources and twice the stakes. She taught them to see patterns, to trust their judgment, to make the call even when protocol said otherwise. She taught them to be the kind of doctor she'd been before Kandahar convinced her she shouldn't be. After the lecture, the residents filed out. Several stopped to ask questions. Rodriguez stayed longest, asking about a case she'd seen the week before. Sarah answered patiently, thoroughly, the way she wished someone had answered her questions when she was learning. When the room finally cleared, Tennant approached. The program's working, he said. Trauma mortality is down 18% since you started. Residents are reporting higher confidence in complex cases. And we've had 6 other hospitals reach out asking about replicating the model. Sarah allowed herself a small smile. Good. The board wants to expand, offer fellowships, make this a national training center. Tennant paused. They want you to direct it. Sarah looked at him. That's a lot of administrative work. I told you I wanted to stay clinical. You can do both. You've been doing both. I have been, Sarah admitted. She looked around the simulation center, at the equipment that had saved lives, at the empty chairs where tomorrow another group of doctors would sit and learn. But I don't want to become so focused on teaching that I forget why I'm teaching. People need to be saved, not just trained. Then keep doing both, Sato said, joining them. Teach during the day, work the ER at night. It's what you've been doing anyway. We'll just make it official. Sarah considered. She'd been working 70-hour weeks since accepting the position. Teaching, operating, developing curriculum, recruiting veterans. It was exhausting. It was also the first time in 3 years she'd felt like herself. All right, she said, but I want to maintain at least 2 clinical shifts per week. Non-negotiable. Done, Tennant said. Jenna approached with a tablet. You have a visitor, says it's personal. Sarah frowned. Who? Senator Harmon. Sarah's expression shifted. She hadn't seen Harmon since the night she'd saved his life. There had been phone calls, thank you letters, a formal commendation from Congress. But no face-to-face meeting. She'd been avoiding it, unsure what to say to someone she'd brought back from death. Send him in, she said. A minute later, Senator Richard Harmon walked through the door. He looked good, healthy, color in his face, moving without the careful fragility of someone still recovering. He was 68, but carried himself like someone younger. His eyes found Sarah immediately. Dr. Calloway, he said. His voice was warm, grateful. Senator, Sarah replied. You look well. Because of you. He crossed the room and extended his hand. Sarah shook it. His grip was firm, alive. I wanted to thank you in person, and I wanted to ask you something. What's that? How did you know? When everyone else had given up, how did you see what they couldn't? Sarah considered the question. The real answer was complicated. Years of training, thousands of cases, pattern recognition built from repetition and trauma. But that wasn't what he was asking. He was asking how she'd had the courage to act when acting meant risking everything. I've seen too many people die to let someone go when there's still a chance, she said quietly. And I've learned that sometimes the protocol is wrong. Sometimes you have to trust what you know, even if you can't prove it yet. Harmon nodded slowly. I've been in politics for 30 years. I've made a lot of decisions. Some right, some wrong. But I've never had to make a decision. Decision where someone's life depended on being right. He paused. You make those decisions every day. That takes a kind of courage most people don't have. Or a kind of stubbornness, Sarah said with a slight smile. Maybe both. Harmon reached into his jacket and pulled out an envelope. I wanted to give you this personally. Sarah took it, opened it. Inside was a letter on Senate letterhead. It was a formal request for Sarah to testify before the Senate Armed Services Committee about integrating combat medical techniques into civilian trauma care, to advise on veteran healthcare transitions, to help shape policy that would affect thousands of former military medical personnel trying to find their place in civilian medicine. Sarah looked up. You want me to testify before Congress? I want you to change the system, Harmon said. The same way you changed this hospital. You've proven that military medicine has value beyond the battlefield, that veterans have skills that can save civilian lives. But it's happening here, in one hospital. It should be happening everywhere. And for that to happen, we need policy. We need funding. We need people in Washington to understand what you've built. Sarah stared at the letter. 6 months ago, she'd been hiding on night shifts, hoping no one would notice her. Now a senator was asking her to testify before Congress, to step into a spotlight she'd spent 3 years avoiding. The old Sarah would have refused, would have found a reason to stay small, stay quiet, stay safe. But the old Sarah had also believed she'd killed her team, had believed her judgment was compromised, had believed she didn't deserve to lead. That Sarah didn't exist anymore. When? She asked. Next month, I'll have my staff coordinate with you. Harmon smiled. You saved my life, Dr. Calloway. Now I'm asking you to help me save others. People who served their country and came home with skills that are being wasted because the system doesn't know how to use them. You can change that. Sarah folded the letter carefully, nodded once. I'll do it. Harmon shook her hand again. Thank you for everything. After he left, Sarah stood alone in the simulation center. The evening sun streamed through the windows, casting long shadows across the empty chairs. In a few hours, she'd be back in the ER for her night shift. Tomorrow, she'd be teaching again. Next month, she'd be in Washington, testifying before Congress. She thought about the journey that had brought her here. Kandahar, the bombing, the 3 years of hiding, the night she'd opened Senator Harmon's chest and remembered who she was. She thought about the veterans she'd recruited, the residents she was training, the lives that would be saved because someone had finally built a bridge between military medicine and civilian care. She thought about the boy in Kandahar, about his mother, about the guilt she'd carried for deaths that weren't her fault. She couldn't bring them back, couldn't undo what happened, but she could honor them by making sure their deaths meant something, by making sure the lessons learned in war saved lives in peace. Her pager went off. ER, incoming trauma. She was needed. Sarah smiled, grabbed her stethoscope, headed for the door. She was Dr. Sarah Calloway, former Army trauma surgeon, current attending physician, teacher, leader, survivor, and she was done hiding. The double doors to the ER opened as she approached. The familiar sounds washed over her. Monitors beeping, voices calling, the organized chaos of people fighting death and winning more often than they lost. She stepped through, ready, capable, home. Sometimes the right path isn't the easy one. Sometimes it's the one that forces you to become who you were always meant to be. Sarah had spent 3 years running from that person. Now she was running toward the next crisis, the next patient, the next impossible decision. And this time, she wasn't afraid. Because she'd learned the hardest lesson of all, that competence wasn't about never making mistakes. It was about making the right call when it mattered most, and trusting yourself enough to live with the consequences. Sarah Calloway had made that call, and she'd keep making it. Every day, every patient, every life hanging in the balance. That was who she was, who she'd always been. And finally, after 3 years, she believed it.